Hey y'all, welcome back to the Soft Landing Podcast, a gentle space for self-discovery. We're your hosts,
Rafaela
and Eric. This week we're pondering who has access to sexuality. Spoiler alert, everybody. So let's talk about sex and disability. To help us out with this, we have another guest joining us, Samara Lillioja, pronouns they, them. Samara is a program specialist at the YWCA of Metro St. They coordinate the SHADE program, which provides sex education for people with disabilities, as well as trainings and presentations for those working with disabled folks. Welcome to the pod, Samara.
Thank you. Thank you so much for having me. I'm excited to be here.
Thanks for joining us.
Mm-hmm. Real quick, is SHADE an acronym?
It is, yeah. SHADE stands for Sexual Health and Disability Education.
Perfect.
I love that.
Yeah.
Very cool. So to start off this week, I have another one of my little questions, little inquiries, little queries for us all. And so I would just love to hear, what's the interesting fact or tool or aid around disability and sex that you've come across?
Ooh, great question. I actually recently have been getting really into seeing adaptive and accessible sex toys, and there's some really cool companies out there, and I've seen one that is this really cool silicone, I wish I knew the name of it, but I just saw a video of it, but it has a magnet so that it can wrap around whatever body part it goes on. It's for folks with really any fine motor mobility issues that need some more accessibility, maybe can't grip something. And it's gotten me down a rabbit hole of finding folks doing accessible sex toy research, which I think is really cool because there's not a whole lot of folks doing stuff like that.
Unfortunately.
Yeah.
And we know why that is, and I'm sure we'll get into it.
Mm-hmm.
I've recently come across something similar. Actually, people just kind of reach out to you and tag you or send you an email. But this company called, now listen everyone, I have not looked into this company. I just remember the email, but it's called Silk Arts, like silicone silk arts. And they create toys that are that have longer handles for better grip and things like that. And they also look really, really cool and long. And
We love that.
It's just like, oh, what is this? So I think it's so important that we are talking about sex aids and sex toys to increase pleasure and accessibility of pleasure. So, okay. What about you, Eric?
So I asked this question because, one, I was in a class and one of my classmates did a presentation looking at, modified sex toys for people with disabilities. So I love that you're bringing this up. And I think for me, when I was doing the research, I came across this project called an Intimate Rider, which I just love the name of it. And
Intimate Rider?
Rider.
Oh, okay.
Yeah. So it's like this seat for people with limited mobility to be able to utilize to have sex. And so I was on their website exploring it, and they have additional pieces for if you have partner play. They also have good positions and all this information. So I was just wow, they are out here doing the work and making some abilities for people to have sexy time and to be able to have a nice intimate ride.
I love that. And the thing is at some point, I say if I'm lucky, I will need all of these things.
Yes.
Right? I like to say that I am going to be sexual from the womb to the tomb, baby.
That's right.
And I want to make sure that I'm able to access pleasure. And so the fact that these things exist is just beautiful. And we have to recognize that this is for access for all of us.
Yes.
At some point.
Absolutely. I love that.
So could we talk about how you got into this work first to kind of ground us in this conversation?
Yeah, absolutely. I somewhat fell into this work, but very serendipitously, I think. I went to graduate school knowing that I wanted to do sexual health education. I did think for a little while that I would maybe want to do more the intervention side of things. I feel like my whole career trajectory has been based on being the person that I needed growing up. And so for me, at first, that started out as being I thought I might want to be a therapist for queer teens, queer youth, because I was that's what I needed. I needed someone that knew about queerness in a therapeutic setting,
Mm.
but learned pretty early on that I just don't think therapy was quite the space for me. I really like the prevention side of work more so, getting in earlier. And so I found that education was really the route to do that. And so really focused my studies on sexual health education for queer people. And then realized that there's a huge overlap there with the disabled population, and that a lot of the issues faced by different marginalized people when it comes to sexual health education, there's a lot of common threads and common themes. And so it's difficult to focus on just one population. And even though the work I do now is disability specific, sexual health and disability education, there is such a huge overlap with so many other marginalized communities that are all facing very similar obstacles when it comes to sexual health education not being accessible, whether it's not accessible based on disability, not accessible based on gender identity, sexuality, anything else. And so when I graduated, I was really just looking into doing sexual health education, which is kind of hard to do. It's a hard field to get into. And there was this job that was sexual health with folks with intellectual and developmental disabilities. I had taken a couple classes on disability specific education, and those were some of the most, like, some of my favorite classes that I was able to take. And so I ended up getting this job and have really loved it since, and found that I have a really big passion for this work. I also, as I was going through grad school, came into my own diagnoses and my own disabilities. And so that's where that like serendipity comes into play. As I was learning more about the inaccessibility of sexual health education, I was also figuring out how that applied to my own life. And all the information that I was never given, tools that I was never given, things that I just wasn't given the opportunity to learn about myself, about sexuality, about the world. And so those two things kind of coincided. And so now I, find myself doing sexual health and disability work. And I've just grown more and more passionate about it the more ingrained in this world that I get.
Mm-hmm. Wow.
Wow.
Thank you so much for sharing that background.
Yeah.
And it's always, not always, but a lot of times it does feel like a full circle, because so many people who do this type of work either have their own background story, or they come into new information about themselves that says, oh, this is my community too.
Yeah.
I thought I was kind of helping in this other way, but actually it's me. And I think that really adds a different flair to the passion and to the level of dedication that people can show up with in their work.
Okay, so do you want to dig into our first bit?
Yeah, let's get into
All
it.
right. So I think that is also really nice to kind of get a lay of the land of what we're talking about today. And so I want us to really start about, like, how do we even define disabled? Right? Like, who is disabled? How is it determined?
Mm-hmm.
What are kind of these cultural views around disability?
Mm. That's a great question, and one that I am always pondering, especially the with the different communities that I work with, different communities that I'm a part of. I think a lot of disability is going to be based on self-identification. I think what doctors see as a disability is going to be different than what individuals see as disabling. And so I think, it's a very self-determined thing. Anyone who's something about their mind or their body is not the mainstream. And so there's different ways that society is structured that make their mind or their body not fit in, whether it's things being physically inaccessible, mentally inaccessible, emotionally inaccessible. But even within that, like, I've had conversations with, let's say, autistic folks, for example, who are like, yeah, my autism is absolutely a disability. And then there's other autistic folks that are like, nope, this is like a neurotype, but not a disability. And so I think that like self-identification piece is really important. And I think disability is such an individual thing in general. Each person's disability is going to affect them in a very different way. And so leaving it up to people to decide what different identities they hold, I think is important. But generally, anyone that finds something that's not accessible due to a way that their body or mind deviates from our societal norm.
Yeah, I think that's really important to break down because, even if you have the same diagnoses, even, it can show up really differently for folks. And then because of culture, family, and all these other sources of information and messages, people will likely relate to their disability differently, right? And so you have, some folks who maybe they were brought up in a family that was like, you're not disabled or you can do, anything. I was thinking about some folks that I know who felt really at a disadvantage sometimes because they didn't have that additional support or because it wasn't, what's the word I'm looking for? Like they just felt like their family didn't support them in that way. So they didn't get the additional resources and the support systems and things like that. Sometimes it's related to access because of money and finances, specifically that people don't have access to those tools and resources to help them navigate. And then you have other folks who maybe it's been generational. So they are very well aware of all the different ways, all the different support systems and the resources to help them identify what they need in this world, So there's so many things contributing to that outside of our own mindset and beliefs, but then we're looking at all of the isms and what that means. And yeah.
That also reminds me of like with disability and something you said earlier about how you hope you're going to have to use like adaptive sex toys later because disability is inevitable with aging. It's, one of the few communities that anyone can become a part of at any point in time. And I think a lot of people then might get stuck on the idea of like chronic versus acute disability. Is someone disabled if they've like broken their foot and they're on crutches for a little bit, versus someone with like a chronic illness they have a diagnosis and they know they have that for the rest of their life. And I think it's important to look at both of those, to look at whether it's temporary, whether it is chronic, it's going to be for the rest of someone's life. And then with invisible disabilities as well, something I hear a lot of with folks with invisible disabilities, and I put that in air quotes, is that they're like not disabled enough. And if life is hard for them or if something is inaccessible for them, if other people can't see it, a lot of disabled people take on the burden of like, well, if they can't see it, I don't want to make it their problem. So I will take on as much of that burden as I can. And that will also lead to people being like, well, I'm not disabled because other people don't see it. And I think that with disability, there is this really huge emphasis on like, you'll get a diagnosis if your disability affects other people. But if it only affects you, then oftentimes it can be a lot harder to get a diagnosis.
Yeah, I really appreciate that. I know, for me personally, I had a spinal cord injury. Gosh, this was like 6 years ago now. Wow, time flies. And my body is not the same, right? I'm personally hesitant to like claim the label disabled because I am, in my opinion, pretty high functioning, but also my body functions differently than what it did. And I think whenever I tell people the story of what happened, they're like, oh my gosh, but you don't look like anything's happened to you. You don't look like this and that. Like you, I'm like, yeah, because, one, you didn't know me before then. And two, also like, you don't experience my body the way that I experience it. Right.
Oh, absolutely.
Yeah. Unless you're like my mom, when she's constantly like, I can notice this. What about that? And I'm like, Mom, I think you're paying. I was like, Mom, you pay a little too close to me my whole life to be able to distinguish that. But it's also nice. But like they don't experience my body the way that I'm experiencing it, and so it can be a little frustrating sometimes for folks to kind of make that assumption of, well, you seem. I think the thought is you seem normal, right?
Mm-hmm. Yeah.
You seem like that standard of normalcy that we perpetuate when it comes to disability.
Yeah. And this, if you seem normal, then what is the idea that they think, or the box that they believe someone has to fit in order for them to validate their disability? This is making me think of a book that I read in the past called Care Work, Dreaming Disability Justice, in which they introduced the concept by Stacy Milburn crip doula.
Ooh.
And it was just like this dream of like, what would it be if more seasoned disabled people could come and sit with you to help you navigate into your new situation, right? Like
Yeah.
maybe you're newly disabled, or maybe you have a new disability on top of some other ones, but this person comes in to hold space for your feelings and share more about community and resources and tools. And it's like, you don't have to do this on your own. And in this book, they talk about the situations where able-bodied people become disabled, and then they have this influx of like support and people, you know, wishing them well, and then it starts to drift off because it's just like not sustainable for a lot of people.
Right.
But then the changes in their community when they get healthy again, right? So it's like, oh, they broke a foot or something, and now they're in crutches or in a wheelchair, and everyone's around them and doing potluck, like doing all the things that's like community care is important. And then they're better, and then all that goes away. It's like everyone's back into their individual lives, and it just really highlights, one, the loneliness that shows up so often within some disabled people's lives, where it's just like people feel like, oh, they're getting tired of me, or I'm a burden, or I can't keep asking for help, and I always need, you know, I have to do these things on my own or just suffer. And so I really, really love that book for a variety of reasons. And they also talk about sex and sexuality, which we will get to.
Yes.
But it was just so eye-opening, just thinking about the community that so many of us want, that we say that we need, regardless of our ability status, but how it's not part of our culture, really. You know, it's like we have to do a lot of intentional work to create that community sense beyond emergencies, you know, especially emergencies, but beyond emergency situations.
Yeah, absolutely. And you mentioned that like it's just not how our society and our culture operates. We do really emphasize independence. You should be able to do everything on your own. But I also, Care Work was one of the first books that I read that really introduced me to just really the disability justice world in general. And I cannot recommend that book enough. But yeah, these ideas of interdependence and community care and just how important they are, not just for disabled communities. And that's an ongoing theme with like disability justice in general. Things that help the disabled community help everyone, not only because anyone can become disabled at any point, but interdependence, community care, and especially sustainable community care. Like you said, not just the moment someone gets injured or the first couple weeks after someone's diagnosis. Like that's important, absolutely. But sustainable community care is a really important part of disability justice and of just caring for our people in general.
All right. Well, thank you both so much for that. I think that, you know, to go back, Samara, to your point about, you know, when we define who is disabled, it really is this personal identification, which I think speaks to that self-determination of each person and that right to really decide for ourselves, right? Like, how do we see ourselves and identify, and then be able to then figure out how to access the resources and the community necessary to support us along the way. With that, I wanted us to, again, continue to define some pieces. So we talked about disability, the episode's about disability and sex. So I want to also talk about, like, how do we even define sex? Because I feel like that is always an ongoing conversation, and I really want to give some space for that as well.
I love conversations about defining sex because I refuse to do it. I love, especially when it comes to talking about sex and disability, but really when it comes to talking about sex and pleasure in general, I always love to bring in the idea of play and exploration and just like creativity and imagination. And I think when you combine those things, there are no limits to what sex is. And so I think the whole idea of what is sex is also very self-determined. What feels like sex to one person is going to be very different to what feels like sex to another person. Now, sure, you'll get some people that might define it as like in some way, like interacting with genitals or something like that. But again, when you take the disability lens, like that night might not be sex for everyone. Sex might not at all involve anything to do with genitals. It might just be like physical intimacy in general, or something that is arousing. And so I love to have big conversations about what is sex, because I don't think there's like a one sentence definition. Here you go, here's what it is. I think it's a very self-determined thing that can be found through exploration, play, self-reflection, things
Yeah.
like that.
I really wish that, when we talk about sex, what really came up was just intimacy. And because right now, usually intimacy is used as a euphemism for sex. And I have to, when I'm working with folks, I'm like, okay, you're saying intimacy. What do you mean? There's so many different types of intimacy. But what if we really thought about intimacy as sex and not just a euphemism for sex, right? Like, what if it is the emotional connection and the physical closeness and that vulnerability, and we can tie that into our erotic experiences and our sexual experiences without it all being centered around what body part went into another, and the genitals more specifically, especially because that may not be one accessible for everyone to do or desirable, right? And if we get really stuck in these limited ideas of what sex is, when our bodies don't work in that way for whatever reason, people start to stack their sense of worth up against the type of sex that they can have. It's like, oh, if this body part doesn't work, or if I can't do this movement or position, then what does that mean about me? It means that you can't do that thing. Go do something else that feels good. But you also have to do the challenging work of kind of relearning pleasure, right? It's kind of like retraining the brain to say, oh, this too works for me. It feels good. It leads to connection with self and partner, and not just thinking, oh, I have to do this thing to orgasm, and then that means it was sex,
Right.
So we're also talking about taking orgasm off of, this
For
top of the
sure.
pyramid of what sex is.
Yeah, I think that's a great point of like removing this expectation of orgasm. I think then opens up for that piece around creativity and play and exploration, right? It shows us that if this end goal of like this big feeling coming over us and bodily fluids coming out of us is not necessarily the goal, then we really get to make up for ourselves what is the goal. Or maybe there's no goal at all, and we're just like experiencing and enjoying the process of it.
But that can be a goal, right? So people talk about like not having goal-oriented sex, but the goal can be we're exploring. The goal can be I just want to see, how long I can last on the highest setting of this toy. Right? It could be, oh, I read this thing called edging or whatever. And it's like the goal can just be to explore that. I think where we get stuck is when the goal is specifically tied to the outcome of orgasm and or penetration that leads to orgasm, and not the goal or outcome of when I said no, I listened to myself or my partner heard me, or the goal of again, try this new thing, or we want to get through this article with a bunch of suggestions, whatever the case is, but like really taking those other things that can really cause a lot of shame or make us question ourselves or what's wrong with me. One of my biggest things is like, if you're struggling with that, like just take it off the table for a little bit. If you're asking these big questions of, is something wrong with me or why can't I do it? Just take it off the table, do something else. Try to retrain our brain that that's not the one and only way to do things.
Absolutely.
To experience pleasure. Do you have anything else you want to add about that, Samara?
Actually, I don't know if it was a workshop recently. I can't remember when this was, but I saw, I think there was an activity that was like create your own pleasure menu. And I really like the idea of something like that. And even if like orgasm is somewhere on your pleasure menu, but like put other things on there too, so that you don't just have, one goal. Because again, if you then aren't reaching that outcome, then yeah, you might feel disappointed. But if you have a whole pleasure menu that you can kind of choose from of like, okay, I want to try this new thing, or, I have a number of things that I could want to get out of this experience. And if I don't hit all of them, that's fine. I just want maybe one or two of these things. I just remember really enjoying sitting down and thinking like, what would be on my pleasure menu? What are goals or outcomes that would be pleasurable, and the different ways of getting there. Again, this whole idea of like creativity and like brainstorming around pleasure, I think is super fun. I know not everyone is like that.
And playful.
But like, creating something like a pleasure menu, I think is a really fun tool to get creative about what people do want out of different sexual or intimate experiences.
Yeah. Another thing that I love about you mentioning orgasm does not have to not be on the table. It's also reminding people that we can orgasm in different ways, right? So there are brain gasms, nipple gasms, skin gasms, kiss gasms, like all these different ways to reach this release, right? After the buildup. And it does not have to be from genital stimulation or penetration. So I really love that you also like, hey, you can still have that, but let's not just put all of the value of sex in did an orgasm happen or not.
Right. I love this idea of like this sexual menu, and I think this might be a good resource to build for this week, because in my mind I was already going like, okay, we're having a 5-course meal. The starter is the buildup, right? Like, what do we need to do to get ourselves in the mood to have the time? And then, those next 3 courses are us really trying some different things out, maybe some new positions, maybe reading some erotica together. I don't know, just all these things. And then the dessert is like the aftercare, something to like really, satiate that little last little bit. So I really love that idea. And I think that it also just brings into this whimsy and the funness that can be had when we're talking about sex, which I feel like a lot of people sometimes lose sight of.
Yeah, but I think tools like that and conversations like this can just feel so validating and affirming for folks whose minds work in different ways and bodies work in different ways, that lets them know, oh, I can give myself permission to do what feels good for me and my body, and not what all of the sex scenes in the movie show me, or what the erotica says, or what the pornography looks like. I can listen to my body and use that to help create this roadmap or this pleasure menu.
Yeah, absolutely. All
right, so that was a really great introduction to this topic. Maybe we take a break.
Yeah.
And then we'll come back to dive in deeper.
Sounds good.
Okay.
Welcome back, y'all. So now I would love for us to get a bit deeper into the intersection of disability and sex, and some of those misconceptions that people might have around it. So when we're thinking about disability, I think it's also important to recognize like there are a lot of different ideas around, or a lot of different categories around disability. So physical disabilities, right? We've already talked about intellectual, developmental disabilities. Also these, in air quotes, invisible disabilities that, people have. And so we'd love to maybe really explore what are some of the common misconceptions that we are aware of and around some of these different types of disabilities.
One of the biggest misconceptions that I tend to see is just that people with disabilities, and this goes for people of like in any of the disability categories, just are not sexual.
Right.
There's a bunch of different thoughts that go into this. So it might be one that I see a lot for folks with intellectual and developmental disabilities is that just they are asexual. They don't want to have sex. They don't, a lot of times there's even misconceptions that they don't want like romantic relationships, let alone sexual relationships, which is not true. There's also thoughts that like people with disabilities just have too much else to worry about. They got, so much going on that sex is going to be the last thing on their mind. And there's just so many different thought processes that all lead to the same misconception that people with disabilities are not sexual. And again, it's just not true. The idea that sex is, um, I guess like superfluous, and that if someone has a disability, they have too much else going on to worry about sex. The whole idea that pleasure and intimacy and all these different words that we've attributed to sex, the idea that those inherently come second or are like not crucial to someone's well-being, that if someone has a disability, they are solely focused on their well-being, and that sex and sexuality is not a part of that, is a huge misconception that I see a lot of. And then an outcome of that, I think, is that folks with disabilities are just left out of conversations, left out of education. So even for those folks that are like, hey, whoa, I am interested in sexuality, it then just becomes so inaccessible. And then other people can look in on that and be like, oh, well, since they're not a part of the education that I'm receiving, or since they're not in these spaces, cool, they must not be sexual. And so we take people with disabilities out of our education, our classes, our thoughts, our research on sex and sexuality. And then that just reinforces everyone's notion that people with disabilities are not sexual. But it's very much so not true.
It also makes me think of, after my spinal cord injury, I was in the hospital for a total of like probably 3 weeks, like surgery for a bit. Then I was in an intensive rehab hospital. And after that, I was in outpatient physical occupational therapy for a few months. And I don't think there was ever a moment where we discussed anything around sex, sexual functioning, anything like that. And you better believe I was, again, in the hospital for like 3 weeks total. And I was horny while I was in the hospital. And I think that that's something that is lost on and not touched on and not dealt with because of this weird discomfort, right, that we have of like, should this be your primary focus? Should this be even a thought in your head, like you were saying, Samara? And I think it's so important to start to really figure out the ways to address that in these systems, because, ableism is very pervasive. And I think what we're also talking about is like this paternalistic viewpoint around people with disabilities, where other people think that they know better for them.
Yeah. And also, why do you have to choose? If I have an interdisciplinary team, why can't I have my nurse, my doctor, my social worker, my sexuality educator? Like, hire these other people who can also address my full self, not just this one part of my sickness. And I think hire the people who can do the work.
Absolutely.
Get the training that can help you be more present for your clients and give them better education and information about their treatment plan. And create a space where they can say, hey, I have some questions. A couple years ago, I have a chronic hip issue that no one knows, because that's just what the medical field is. Don't know how it came, don't know what to do.
Yeah.
But whatever. But a couple years ago, it was like really bad, and I was falling and all types of stuff. And so I'm going to physical therapy, and, I'm talking about, hey, so how can I do these positions? Because right now there's excruciating pain and stiffness and locking up and all this. And she was just looking at me like, okay, well, I haven't had that question before. I'm like, okay, cool. But could you help me figure out what is something that's more comfortable for me? Or is this person aware enough to be able to carry that conversation with you, to talk about your sexual concerns and your desires and how they can incorporate that into treatment? And it's just lacking overall, And so that's why we do need people like you, Samara, who are providing that sex positive, inclusive, accessible sex education for everybody and all bodies.
Yes. All bodies. Absolutely.
And I think to what you're saying, that like medical self-advocacy is hard, first of all. And then for folks with disabilities, and we've brought up this idea of feeling like a burden a couple times already, And I hear so many stories of people sharing just what their life is like with a disability with their medical team and being dismissed.
Mm-hmm.
Of, again, this kind of goes back to the whole, like, in air quotes, invisible disability, or just the idea that if it doesn't affect other people won't believe you, or, won't listen to you. And I think that comes up with advocacy, medical self-advocacy, or really with any like helping professionals, um, is that a lot of times the helping professionals reinforce the idea of like, oh, you bringing up all the different things that you're worried about, that you have questions about, like that's a lot and that's too much for me.
Mm-hmm.
And I think there are like two main ways to kind of handle that. There's the one, everyone needs more training about how to talk about sex and sexuality.
Absolutely.
Anyone whose job it is, whether it's like a medical professional, helping professional of any kind, should be able to talk about sex and sexuality in some way. And we need to have the interdisciplinary teams so that if it surpasses what you are able to talk about, you know who to refer to. And especially when it comes to sex and disability, like there's not a lot out there. There's even with my own, with my own job, I have a long wait list, and the like two or so other people in this state that do sex and disability education are referring people to me because
Wow.
they are full. And there's just, it feels like an untapped world of like, whoa, there's so many disabled people. Anyone could become disabled at any point in time.
Mm-hmm.
And yet we just do not have enough people that know how to talk about sex and disability in an empowering and like collaborative way too. And so I know that I try to kind of take both paths at the same time. I try to provide trainings on like how to have those at least initial conversations about sex and sexuality, even just healthy relationships. A lot of people are like, hey, if you're disabled, you shouldn't even be thinking about like dating someone.
Yeah.
Focus on
Right.
yourself.
Yeah.
Kind of reminds me of the like, if you can't love yourself, how are you going to love anyone else? But applied to disability of
Yeah.
like, if
Yeah.
you have your own things going on, like how on earth can you be in a relationship with someone else?
Yeah.
So yeah, we really need more people just feeling comfortable talking about sex, sexuality, disability. Um, I've had conversations with a lot of folks that when they are prescribed like anti-anxiety meds or SSRIs, really any medication that could have side effects on someone's libido, that their prescribing physician, psychiatrist, whomever, just did not mention any of the side effects that could affect their sex drive. Um, and that when changes started happening and all of a sudden they're like, ooh, I don't really want to have sex anymore, or I'm like not self-lubricating as much anymore, whatever the side effect might be, that a lot of physicians just don't mention the like possible sexual side effects. They might mention some of the others.
Mm-hmm.
But I think it does stem from this issue of just there's so many providers out there that just do not feel comfortable talking about sex and disability.
Do you have any tips that you provide your clients around self-advocacy or things they can say to their treatment provider, their doctors, to kind of just help them a little bit with expressing their needs?
Yeah, when I'm teaching my classes, oftentimes I'll do it very like step by step. So the first step might be like checking in with your own body so that you can figure out what, because a lot of folks with disabilities are told to like ignore their own body cues, ignore their own discomfort, especially if it's going to be a burden to other people. So a lot of times that first step might just be like, where do these things live in your body? How can you check in with your body to figure out um, what you're needing to advocate about? And then a lot of it is learning about, more unlearning what folks know about setting boundaries and advocating for themselves. A lot of that is unlearning that having a disability is a burden, or unlearning that advocating for yourself is inherently burdensome or selfish even. And so a lot of that is modeling and validation. So telling folks like, hey, if your doctor is ignoring you, you deserve to speak up. the amount of times that I say sentences like that in my classes, like, you deserve to tell someone how you feel. You deserve to tell someone if they have crossed your boundaries. Sometimes I'll even say, like, you deserve to hurt someone's feelings. And that's a really hard thing for people pleasers. And I think a lot of folks with disabilities have been taught into being people pleasers. Um, and so saying, like, yes, advocating for yourself or setting a boundary, whatever it might look like, might hurt someone's feelings. And if your feelings are being hurt, or if your body or your brain is being hurt, or you are uncomfortable because of how someone is treating you, you deserve to say something about it. And a lot of people have just not heard that before. Mm-hmm. And that is not ingrained in their body. And instead, when they feel uncomfortable, or again, like when a doctor dismisses them, it's like, okay, well, the doctor knows best. The doctor is the medical professional here. But no, we've mentioned disability is often a very individual thing. Two people with the same diagnosis might have completely different symptoms, completely different manifestations of their diagnosis. So medical professionals, yes, they have their own expertise, but each person is the expert in their own body and their own experience, which means that you are the only person that can most effectively advocate for yourself, and you deserve to do that. You deserve to speak up for yourself, even if you think it is a burden to the medical professional or to whomever. You deserve to be heard. You deserve to speak up on your own behalf. And then sometimes we can practice what that is going to sound like and rehearse it a little bit. And, come up with the sentence that someone wants to say to their doctor, whether it is just expressing, like, the symptom that they've been struggling with that their doctor has been dismissing, or even rehearsing saying, like, hey, it does not feel like you are hearing me. It does not feel like you are taking me seriously. Practicing saying those things can be a huge help, because then when you're in the doctor's office, it can feel a lot more daunting. They're seen as an authority figure. A lot of folks with disabilities are taught to just listen to authority figures, not question anything. So that validation and then actually practicing what they could say, I've found have been helpful tools for some of my students.
I love that permission to also write it down. You don't have to memorize the thing. I've worked with a lot of folks where, especially if they're people pleasers or they're struggling with stuff, I'm like, get your phone, go in your notes app, right, or go to your predetermined text and write out the thing. Hey, thank you so much for inviting me, but I'm not available that day. So that in that moment when you're feeling anxious and all these thoughts are rushing in your head, you're not like typing and deleting and trying to figure out the best way to say it. You've already written it out. Right. So if you have these concerns, get your notebook. If you have someone who can help you, sometimes it's really helpful to have someone attend your appointment with you to help you advocate, help you remember things, because it can feel so anxiety producing and invalidating, and you may forget some stuff. But give yourself permission to use other tools to help you. You don't have to just do it by yourself, even if that means using a piece of paper. So I really love that. It's like practice, role play. Also have a script if you need it.
Yeah, absolutely. Even when we're talking before about like this assumption, particularly from doctors, of like, oh, they didn't even tell me that this is going to affect my libido. Like, that's harm being done to people. Like, that is
it's not informed consent.
Yeah, it's negligent. And I think that, it then it does put this onus on people with disabilities to do the work. To get their needs met. And so I feel like, particularly, we've been talking about like medical people. I think it's such a significant barrier for people with disabilities really trying to navigate like having sex, having the sex that they want. But I want to also talk about what are some other barriers that folks with disabilities face when they are trying to have sex.
I think that the different barriers that people face, I mean, again, I keep coming back to this idea. It can be very individual. So depending on the disability, it might be that someone has never had access to education that is relevant to their body or to their brain. If someone becomes disabled later in life, that barrier might just be like relearning their body. And I think we're kind of new to the idea that things like gender and sexuality can be fluid. Disability can be fluid as well. And then someone's like sexual behavior can be fluid. And I think as a society and even as like sexual health professionals, we're still somewhat new to these ideas of fluidity, because I do think that we live in a society that does want to be able to like land in one spot and stay there. Fluidity challenges a lot of societal expectations. But this idea that disability is fluid as well can, and the fact that we don't have resources around that means that it might be a barrier for someone to relearn their body. Someone might have to do that process many, many times in their life. And I just don't think that we give enough attention to what it means to relearn your body. Especially, and I like that, Rafaela, you brought up the idea of a disability doula earlier. I was just recently talking to some like chronically ill friends of mine, and how a big part of disability is often grief. Grieving what you thought your life might look like, grieving hobbies that you may no longer be able to do. There's lots of ideas of loss that can come with disability, and I think we focus a lot on that. And again, I like to bring in ideas of exploration, creativity, and play of like, yes, doors can close. What doors have opened though? And I just don't think there are a whole lot of resources for what it means to relearn your body after becoming disabled or after your disability changes. Just the idea of bodies, disability, sexuality being fluid. I don't think that we have a lot of people talking about the intersection of relearning what sex might mean for someone. And so I think that pretty much the biggest barrier for folks with disabilities is often education and resources. The fact that a lot of folks, if they are not disabled, just don't, a lot of people don't want to think about it, because again, anyone can become disabled at any point in time. So a lot of people are like, I don't want to entertain that idea. So I'm just going to think about able-bodied neurotypical sex. And so then you really only have disabled folks for the most part having these conversations. And so there's just not enough resources put towards the disabled community and thinking about sex and pleasure. I think another barrier for sex and sexuality for folks with disabilities is capitalism in general. I think we have, kind of speaking to the idea of spoon theory, someone having low spoons one day, high spoons another day, and ideas of like productivity, prioritization. I think that's one of the reasons that sex and sexuality can be put on the back burner, is if someone has like a low spoons day, I think the assumption, I would hope that the first assumption is like, take care of yourself and your body, but that's really not. It's make sure you can do your job. And so then intimacy, eroticism, sex, sexuality, pleasure get put on the back burner because of societal expectations of how someone is going to prioritize their life, their time, their spoons. And so when it kind of brings me to the idea of everyone has the same 24 hours in a day, and how that is so not true.
Right.
And disabled folks have a very different 24 hours. When it's like, like if someone has chronic pain, like the stretches you have to do in the morning just to be able to like move your body in a way that is going to get you through the day. Or maybe your stretches aren't helping that day, and so you can't, get up and go into work, and you have to work from home if you're allowed to work from home. And so capitalism ends up affecting how a disabled person is able to live their life, how someone is going to prioritize what they do in their 24 hours. And because we live in a world, it also brings me back to the whole individualism and independence, and how we prioritize independence over interdependence. And so a disabled person needs to be able to provide for themselves and needs to be able to live life independently. And that is not always possible.
Right.
Yeah.
And then when that's the case, the blame is put on that person. And again, they're considered a burden.
Yeah, they're not a good disabled person.
Yeah.
Yeah.
Exactly. And I think a lot of these ideas, a lot of these societal expectations and norms are rooted in capitalism, and the idea that everyone everyone's value comes from their productivity. I even think like when we talk about things like someone's functioning level, like when I talk about disability, I try to use how much support someone needs. So I might say like, oh, this person has lower support needs or higher support needs. A lot of folks will use like functioning labels, like this person is higher functioning or lower functioning.
Yeah.
Even a lot, like whenever someone says something like that, I always do wonder, like, functioning in what way?
Right.
Because there are so many different ways to function. Are you, functioning highly, again, in air quotes, like socially? Are you, socializing enough? Or are you able to produce value for your company, your organization, whatever? So are you like professionally functioning? Are you taking care of your body in whatever ways possible? Like in what areas of your life are you functioning? Because so frequently when we talk about someone being like high functioning, most of the times we would say like they are still able to do their job. And someone that is not able to put time into pleasure, sexuality, oftentimes that would never be considered someone that is like low functioning or someone that is struggling more with their disability, because the priority is just really put on the value that someone is able to produce with their job. And so I think capitalism really colors the way that we view disability and how disabled someone is, or how they should prioritize the spoons that they do have on any given day. And that takes a lot of autonomy away. And we've talked about self-determination a lot. And I think just living in a capitalistic society, a lot of that self-determination is taken away when it's like, hey, you have to put your spoons towards producing monetary value so that you can make a living, so that you can survive by producing value. When it would be wonderful if we lived in a society that really prioritized community care, interdependence, and people could prioritize their life and the different areas of their life in the way that best worked for them. But that's not really the reality. And so then it is demonized when disabled folks do want to advocate for themselves and their sexuality, because it's like, wait a second, you should just be worried about a job. You should just be worried about producing value, contributing to society, in heavy air quotes. So I think, yeah, capitalism is a big thing that affects the disabled community and a huge barrier to seeking pleasure and just creating an individual relationship with their own sexuality.
That example just gave me a flashback of like when you're sick and you're at home, so you miss school or something.
Yeah.
But then if you're laughing or you're having fun, your parent is like, oh, I thought you were sick.
Yeah.
I guess you're going to school tomorrow, but you're like, I don't have the energy for school, but I do have the energy to watch this fun video or play video games or something like that. So I can hear how it's like, why are you I thought you were so sick. I thought you had no spoons, but you want to use your time and your energy for dating or having sex or doing something like that when you could be doing this other thing.
Producing.
So yeah, when you could be producing, and it's just like, yeah, that's what we do.
Yeah. That's a really great point. So thank you for that, Samara.
I wanted to take a little bit of a turn when we're exploring these barriers. And I wanted to ask you about parents and caregivers and caretakers and how that shows up as a potential barrier, and what might be some tips or advice or resources for disabled folks who are younger and or are in the care of other folks, or living in homes of parents, or even a community space where there's like a director or a house manager or something like that, where maybe that system is part of the barrier.
Yeah. I think two directions that I kind of want to speak to. There's definitely the like individual role, the like things that person can do. And then there's the bigger societal look that I think is so important, that like we need education for parents, for caretakers, for guardians, for the staff at organizations. Because a lot of times for folks with disabilities, if they are not their own guardian, or if they are under the age of 18, then it isn't their choice what resources they have access to, what classes they are allowed to take. And so there's only so much that the individual can do sometimes. So we have to have the education piece for caretakers, guardians, the staff at organizations to say, hey, everyone deserves access to education, to accurate, accessible, comprehensive education.
So like getting their buy-in. It's very similar to sex education in general, right? Like
Yeah.
some schools you have to opt in.
Right.
In order to participate, or some parents are saying like, we don't want this person teaching our kids sexuality education, and it's to the regular it's like the full school body, right?
Right.
So then add in these other things that are paired with the message of this is inappropriate, or they won't know what's going on, or they can't really conceptualize what it means to be in a relationship or to have sex, so they don't need access to this information. I can
Yes.
imagine it's harder.
Exactly. And so I actually think the biggest piece of accessibility um, is that broader societal education, which is a huge barrier to overcome. But again, we can slowly kind of chip away at it and teach caretakers, guardians, the staff at organizations. I think it's unfortunate. A lot of the ways to get through to people is that like abuse prevention lens of like, hey, you need to teach them about the names of their body parts and good versus bad touch so that they can speak up if something bad happens. And oftentimes that is kind of the I don't know, the framing that you have to take to get through to some people. And then hopefully the actual education for folks can be much more empowering and much more pleasure centered and like, hey, you do have autonomy over your body. You deserve to make choices about your own body, and you deserve to make informed choices, which means you deserve access to accurate education. So sometimes it's getting a foot in the door and saying, hey, there's a higher prevalence of violence for the disabled community, and education is one of the most well-known ways to prevent that. Some people are receptive to that. And even still, some people are like, no, I think that teaching this person about their body or about sex as a concept is going to insert the idea in their mind that they otherwise weren't thinking of. And again, I think people see disability, whether it is a physical or, intellectual or developmental disability, as being so inherently different that like they're not even thinking about sex, that if they have an educator come in and teach them about sex, that all of a sudden it's like a new concept to them. The language around it might be, but a lot of people's bodies are going to be doing sexual things in some way, whether or not they have the language to describe it. Language is just this hopefully empowering tool to be able to talk about it, because communication is a very important part of healthy relationships and a healthy sexuality. Yet we're not giving a lot of folks with disabilities the language to have those conversations. And like you mentioned, a lot of times this education is opt-in, or people at the very least get the opportunity to opt out. And so I think that's one of the biggest barriers, is teaching people why this is so important, who it can help, why it's helpful, so that you can do the education in the first place. And then I think with folks with disabilities, it is just a matter of, again, I come back to this idea of validation. That has felt like a really huge part of the work that I've done, of just, it's normal for your body to feel that way. It makes sense that you feel upset when someone did this thing or said this thing or ignored you in this way. I've found that a lot of my students just don't receive a lot of validation around how they feel, how their disability manifests. And so just having that person to give permission of like, hey, yeah, bodies feel that way sometimes, or you're allowed to feel upset when people treat you this way, or this is how like you can build a healthy relationship, or, giving people tools that they are not getting in many other places. But you got to get your foot in the door first, which is often the hardest part.
So what I would love for us to maybe touch on now, as we're kind of going into this continued barriers or impact on people with disabilities and sex, is, what does safer sex practices and reproductive health also look like for those with disabilities? Because I think that's also a really big piece that can be such a big impact as well.
I mean, we've brought up this idea of informed consent a couple of times. I think that's a huge thing that's missing right now. The informed piece, especially, is that since a lot of folks are not wanting to have conversations about sex and disability, it means that a lot of disabled people are not informed about again, we've mentioned like the side effects of their medication, or a bunch of different ways that disability and sex can relate. And so I think the informed piece, whether that comes from medical professionals or sexual health educators, just putting more resources into information about sex and disability, and then making sure that information is accessible to folks with disabilities. And again, recognizing the like legality sometimes of someone having a guardian or anything like that, making sure that this information is accessible to anyone that needs it.
Well, I'm honestly blanking out a lot here, but I'm blanking out in a good way. But I'm thinking of like just stories I've heard, and I'm just thinking, but I don't really want to. I like want to say it, but I don't want to say it because it just feels like I'm pointing out all the like, see this example of why this person had an STD, but then they never checked because they didn't think, I don't know. I'm just like, my head is all over the place about what do I exactly want to say, what's helpful, while also keeping in mind that I really want this episode to be twofold. I want it to be really informative for other educators and potential caregivers, but I also want it to be for the disabled folks. Right. And I'm being really mindful that like, okay, so it sounds like we all have some different degree of ability and disability, but also I don't identify as a disabled person, and I'm in this place of like taking up space, but I'm just really cautious and intentional about like taking up space, I think. And I don't want it to be a bunch of like, I heard, like, I can't speak from it, so I'm pulling the, you know what I'm trying to say?
I think
there's a little internal conflict.
I'm also trying to straddle that line, so I feel you.
Okay, cool. And not just being like another talk down, like talking down. I don't know.
I'm right there with you.
It's tough.
Honestly, though, I think that just kind of speaks to, because I've been doing the exact same thing where I'm like, when I talk to people about this, when I'm like, half of the times when I say that, it's like, oh, well, that's like my experience as a disabled person. But a lot of people that experience some sort of disability, or again, just their body does something different than the norm, their brain does something different than the norm. I feel like most people in that space are like, oh, but I don't want to like take up space on account of this difference. And so I notice that in myself a lot of the time when I don't validate my own experience as a disabled person. In fact, a lot of times I speak from a very professional standpoint of citing my professional experience, saying when I do this for my job, I hear a lot of XYZ, when really it's no, this is my expertise as a disabled person, which quite frankly is more valid than like professional experience working with disabled people. But because a lot of people dismiss disability, I have put on this idea of, or I guess I project the idea of like my experience is more valid as a professional that works with folks with disabilities than my lived experience with disability. And that's a really hard space to navigate of like, which are other people going to see as more valid? Which do I see as more valid? And why are we thinking about validity in this way in general? I think that kind of is like I don't know if I would call it like a microcosm of the disability conversation in general, but a lot of folks that experience differences in how their body works are like, ooh, but I don't want to make that anyone's problem. I don't want to speak from that perspective because now I'm othering myself, and I don't want, folks to disregard me because I am othered. I want them to see me from this, again, this like put together professional persona and not the person with a disability.
Oh, that's so good. It's time for another break. And we'll be back in a moment.
All right, y'all, we are back. And as we're, getting closer to the end of the episode, I want to make sure we start to talk about how can folks with disabilities start having the sex that they want, right? So we'd love to just chat about that. What does that look like? How can, people with disabilities really start to explore what their sexuality is for themselves?
Yeah, I think that there have been pieces of this conversation that we've brought up that I think would be great to bring together here, which is the idea of play, fun, creativity, exploration, and there can be like tangible tools for doing things like that, like a pleasure menu. And so, maybe it is taking one very specific goal off the menu or just adding more things to the menu and having fun with how you get there. Something that I thought about, we've talked about like not self-lubricating and like vaginal dryness a couple times, and something that made me think of was like add to your menu finding out how much lube is too much, if any. Like that could be your goal of an intimate encounter, is see if you can get to the point where you're using too much lube and you need to like rein it back. Or find different props, toys. They don't have to be specifically like disability or like, toys created for the purpose of accessibility. It could be like, what are different fun ways that you can use your pillow? Can you prop your hips up and is that going to relieve some lower back pain? Or if you can put the pillow in a certain way under your neck, like, can that help with anything? It could, again, like just build out your pleasure menu, whether that is something you do in your head, whether that is something you do on paper. I really like the way that you put before, like you've got your appetizers. Figure out what that is. Figure out, I like to think of like setting the five senses. And so is your pleasure menu like you light some incense or you light a candle? Is it you turn on a lamp? Do you have music going? Are you going to eat any food beforehand, have any drinks beforehand, or have something at like the bedside table? And so figuring out just how broad pleasure and intimacy can be, I think is kind of that first step. Like, hey, it doesn't have to be orgasm focused. It doesn't have to be genital focused. It doesn't have to be based on any of the ideas that society says are sex or are intimacy. So first, figure out what can be pleasurable. And that's kind of that exploration piece. Think of someone's body like a playground and, figure out what you find, what noises are made when, you touch here, or how much pressure can this body, like treat it like a playground, have fun, explore. And then once you've kind of done that, or concurrently at the same time while you're, treating it like a playground, build out your pleasure menu. Mm-hmm. What are different things that bring pleasure? What are different things you want to try? What are some of your pleasure and intimacy goals? And sometimes, trying not to always focus on orgasm. If that is a focus, cool. See if there's other things on the menu too. But I think, yeah, the biggest piece of advice would be play around, have fun, broaden your horizons, because it's going to look a little different for each person. So figure out what pleasure and intimacy works for you and your partners.
And give yourself grace to not feel like you have to have the same menu every time. Create different menus. Think of it like different cuisines, right? Different types of restaurants. I think that can be very permissive and allow people to explore more fully.
I've seen some people create in the spirit of having, different restaurant menus or different cuisines. I've seen a lot of resources for like chronically ill, disabled folks that are like, have your low energy morning routine or your mid energy morning routine and your high energy morning routine based on what type of day you're having. Or sometimes it'll be framed as like your low spoons, medium spoons, high spoons routine. And going back to your idea of giving yourself grace, something I wanted to highlight, because I've said this before, that like people with disabilities, there's this misconception that sex is put on the back burner and that it's not something they're worried about because they have too much else to worry about with their disability. In the spirit of folks with disabilities giving themselves grace, it is also okay if that is the case. It is okay if you do have a lot going on with your body, with your brain, with your disability, and sex does get on the back burner. Right. I think it's a misconception that is always the case or that should be the case. And I think there's probably a lot of shame in the disability community for folks that are like, I have so much going on. I haven't been putting time into my sex life or my sexuality. And I think that's a piece of giving yourself grace as well. If you haven't been giving yourself that time, that is okay. You have to prioritize your life in the way that is best for you, and no one else is going to know what prioritization is best for you. If it is something that you do want to move higher up on the priority list, cool, you can start small. Start by maybe thinking about your pleasure menu. You don't even have to put anything on paper, but that giving yourself grace means, yeah, some days you might have high energy, some days you might have low energy, sometimes you might be putting a lot of thought into sexuality and intimacy, and some days you might not be putting any thought into it. Some weeks or months, years, you might not be putting any thought into it. And I think that there's a lot of fear within the disabled community that one person stepping back from sexuality, if they have a lot else to worry about, that then reinforces the stereotype or the misconception that disabled folks are not sexual. And so I think it's important to say that, like, no one person is responsible for the perception of a community. If what is best for you is that you don't have time to worry about sexuality, absolutely. If that's best for you, make that choice, please. And for someone else, they might have a lot going on with their disability in their body, and thinking about sex and sexuality is going to be important for their wellness at that time. And they deserve to be able to make that choice for themselves as well. And so I think people giving themselves grace can go any number of ways. Again, recognizing the fluidity of disability and how things may change. And so all you can really do is honor your body at any given moment.
Yeah, I think that also really speaks to our previous episodes around sexual liberation and also sexuality, where this idea of like, oh, well, to prove that we are these sexual beings, we have to be having sex as much as possible at any given time, at any opportunity, to reinforce this idea of us being sexual beings, when in reality, like you're saying, like, each and every person has their own conceptualization of what these things look like, what they mean, even when we're talking about what is sex in the first place. And so I think that's a really important piece to also just reiterate. And then the fact that at the same time, you know, this idea of disabled people being, you know, asexual as a whole is not okay. And there are people with disabilities who are also asexual, right? And so how do we make sure that we're making space for all the vast experiences around sex and sexuality within this identity group that's also valid amongst all people, right? There isn't this prescriptive way to be disabled. There's also not this prescriptive way to be sexual, and especially when those two things meet.
Absolutely. Sexual liberation made me think of an idea in Angela Chen's book, Ace, that this is definitely paraphrasing, but it was something like sexual liberation is not just the idea that everyone should be able to have as much sex as they want, or rather sexual liberation as the idea that everyone should be able to have as much sex as they want includes people that do not want to have sex.
Yes.
And that is often a missing piece of sexual liberation. Someone that is quote unquote sexually liberated is not necessarily the person that is having a whole lot of sex because that's what they want to have. It could also be the person that is very knowingly listening to their body and not having sex when that is not what their body wants.
Yes.
And I do think that's a missing piece of the sexual liberation conversation. And it gets a little complicated when you intersect that with the disability community, where a lot of people are saying, but you're not supposed to be having sex.
Right.
Yeah. I think what I'm hearing is this thread of let's not bring in the things that aren't working. And we talked about that in previous episodes where it's like, oh, we're creating this new understanding. We're going to this new place. Let's leave the baggage. Let's not bring compulsory sexuality over here, even though we're saying like people are sexual. They're on this spectrum. And just because one person is asexual or allosexual, we're not going to just lump everyone together. So I think that's really important to remember is this whole conversation is very permissive. It's very expansive, that people get an opportunity to see how they show up, what they want to challenge, what feels right for them without anyone else saying, oh, that is the representation of what it means to be disabled and sexual. It's like, no, that's just one iteration, it's just one version, and that's just one version of them today.
Yes.
Because next month,
absolutely,
maybe they're not interested for a variety of reasons. And so just being really mindful of that is so, so important when we're talking about creating space for people to simply exist and to exist in a way that allows them access to whatever it is that they want to explore.
Absolutely.
Mm-hmm.
All right, y'all. I think we're drawing to a close.
Mm-hmm.
So I think the two pieces that I really want to pull out for resources this week are this sexual menu, which I think is just really fun, and I'm really excited. I'll probably end up doing it myself. With that, we are at the end. Samara, do you have any final thoughts for us?
I want to just thank you both for letting me come on and have a conversation about sex and disability with you. I really love having conversations about sex and disability, and especially like pleasure and, quite frankly, like the joy of sex and disability and the imagination and creativity that can come with that. And I don't often get the chance to have those conversations. Oftentimes, the conversations about sex and disability have other focuses. And so just being able to talk a little bit about how can you build like the sex life you want as a disabled person brings me a lot of joy. So thank you both for giving me the opportunity to come on here and talk to you about it.
Yeah, I really appreciate it. I feel like I've been really self-reflective in this space too, so I really appreciate just the opportunity to really be in this space with you around this conversation.
All right. Well, thanks again, everyone, for listening to the Soft Landing Podcast, a gentle space for self-discovery. If you are digging this content, please share with all of your people, subscribe to the podcast so you don't miss an episode, rate and review us, and be sure to follow us on Instagram at Soft Landing Podcast. Go to our website, healingexchange.com/podcast, and be sure to grab your worksheet for this week.
Yeah, and with that, next week, come back through and join us as we talk about safer sex and pleasure. All right, y'all. Thanks again, Samara. Thank you, listeners. We'll see you next week.
Bye.
Bye.